Oyeni Obafemi on March 6, 1909. Obafemi Awolowo was a prime architect of Nigeria's independence and most consummate advocate of free education and social welfare in Africa's most populous nation. Erudite politician, thinker and philosopher, Awo was fondly addressed by associates and political colleagues, brought his unique attributes to bear on governance in the defunct Western region. He administered as leader of government business and the premier between 1955 and 1958. Obafemi Awolowo's premiership witnessed pioneering in the multi-sectoral policy initiatives and execution. The Western region under his administration paraded several enviable records. First television station in Africa, first real estate in Nigeria, first high-rise building in Nigeria, first modern sports stadium in Nigeria, first agricultural settlement in Nigeria, first modern civil service secretariat in Nigeria, and first industrial estate in Nigeria. His face is on 100 naira denomination as a mark of honor for his distinguished services to his country. Western Spring Television identifies Obafemi Awolowo as a major character in history. Hilas Olayinka Herbert Macaulay, politician, nationalist and journalist, was the first Nigerian to qualify as a civil engineer, surveyor and architect. Born on November 14, 1864, Herbert Macaulay was the founder of Nigeria's National Democratic Party, the first political party in pre-independent Nigeria. Scholars of Nigeria's political history describe Herbert Macaulay as the intellectual bulldog of 19th century Nigerian nationalist movement, in the deference to his qualities as founder and leader of two foremost political parties, Nigeria National Democratic Party (NNDP) and the National Council of Nigerian Citizens (NCNC). His matchless versatility in party organization and control kept the British colonialists on their toes in the entire span of his active life. After his death on 7th May 1946, Herbert Macaulay remains a hero of his country, which recognized his anti-colonial struggles. Today, Nigeria's 10 naira coin bears his oval face and trademark moustache. Western Spring Television identifies Herbert Macaulay as a major character in history.
Biodiversity extinction is everybody's business. So I grew up on farms. So in my early life, I was exposed to a lot of biodiversity and natural environments. And as I grew up, I started to notice these environments disappearing. My main mission was to protect this area from excessive poaching, both of wood and of the animals that live within the forest. Every member of the ecosystem is playing a critical role. The trees are carbon sinkers. The forest and vegetation give us oxygen. Natural vegetation like this is responsible for rain. During the rainy season, you have trade winds that are coming off the Atlantic. The forest creates a barrier to that wind. If you don't trap that moisture, then you don't get cloud. And you get less and less rainfall over time. And that's what we're experiencing now. We also need to keep the carbon dioxide levels within a normal range, otherwise it becomes a greenhouse gas. And that's what's responsible for global warming. Climate change and loss of biodiversity is a signal.
From bedside to boardroom, merging medicine and management. Once, being healthy meant going to the doctor when you were sick. Health has evolved. It's not limited to medicine anymore. Mindfulness, movement, meals, and the moments in between have been incorporated. Now it is about preventing and or managing health condition. You're welcome to Spring Clinic, a health flagship of Western Spring Television. I am Timitope Ajijola Oluwaola. Now, this new season of Spring Clinic, I am delighted to announce our working partnership with the UNIOSUN Teaching Hospital, Osogbo. Today, we'll be unveiling something deeply personal and increasingly relevant in modern healthcare. What it means to wear two white coats, one as a family physician and the other as a hospital administrator. The one is rooted in the intimate, one-on-one care with patients. The other is strategic, broad, and systems-based. Now, these roles seem worlds apart, and yet, in many ways, they are deeply connected and, when balanced well, incredibly powerful. Outside of health and medicine, my eyes are beholding leadership by example. You say shortly, I am altruistic, I know, and you are welcome. My guest has gone through the rungs of medical training, practice, and associations. He's an associate fellow of the National Postgraduate Medical College. He's also a fellow, trainer, and examiner of the West African College of Physicians. A living soul, husband, father, physician, teacher, leader, researcher, pioneer, philanthropist, mentor. A man with a clinical heart, administrative mind. Devila, I present Dr. Babatunde Adeola Afolabi as a Chief Medical Director of the Osun State University Teaching Hospital, Osogbo. Thank you for making time out of your busy schedule to be with us on the show today, Doctor.
Yes, thank you very much for having me on this Spring Clinic, the maiden edition.
Yes, this new season.
Thank you.
All right, let us start this way. Can you describe your journey from clinical practice to hospital administration?
Well, thank you very much. Once again, I want to seize this opportunity to appreciate our viewers at home. This is a very good program, and I want as many that are privileged to always join and in listening to this program. Well, your question, I started my career as someone who wants to be a medical doctor. And being a medical doctor, it's shadowed with so many responsibilities. I have been privileged after finishing to serve in many capacities. From residency training program, you are trained not only as a doctor, as an administrator.
Okay.
You are trained as a researcher. You are trained as an advocate of your patient. You are trained as an educator of your patient. So immediately I finished as a fellow a doctor. I was able to key into so many administrative roles, like being the HOD of my department. I even started as a senior registrar in department where I served as the chief resident in the Department of Family Medicine, and to be a pioneer, chief resident in my department in those good days. And following which I became the training coordinator. Subsequently, I went in to become the HOD of the department, serve as a director of NHIS. And that is not enough. I became the CMAC of the hospital, that is Chairman Medical Advisory Committee of UNIOSUN Teaching Hospital, where I served 2 times. And the first person that will have fully 1 year in acting capacity. The structure in the teaching hospital alive for 4 years, but I was privileged to serve for 5 years. And that in itself has opened my eyes to a lot of things in administrative work. And to crown it up, becoming the CMD of the teaching hospital has really opened my eyes to a lot.
I wanted to ask, so you're saying, in essence, that residency prepares you to wear as many hats, as a medical doctor clinically now and as an administrator.
Yes, exactly. That's what I'm saying. In terms of training, you are trained not only to be a doctor, because you are more or less a 7-star doctor, having to be trained as an educator, because you have to educate your patients. You have to advocate for your patient. Most times, patients don't really have advocacy role in Nigeria. You are trained as an advocate of your patients. Apart from the fact you are treating them, you research into patients' lifestyle. Researching into their lifestyle having to do with the way and manner they are being managed. Sometimes a patient who has fever may have all their associated condition. Okay, you might have researched that, this drug will not be useful for this patient at this point in time. So you are also a researcher. And apart from that, you also play a role as a clinician, treating them, as it were. And you are administrator. Okay, administrator, because every health condition has associated administrative component. And that is why I believe that the structure of a teaching hospital is the best. Having to put clinical service on one side and administration on the other side, the two goes together. If you don't formulate policies, you won't be able to manage effectively the health sector.
Right. Well, you've said it now that for most of your practice, you've been, a physician, an administrator, but I'd like to still ask, do clinical staff respond to you differently, because you're an administrator and, a practicing physician? Has there been, a different response? Yeah.
No, there is no different response because the setting up of a teaching hospital is very clear. There is an operational manual.
Okay.
The manual spells out everybody's role. Everybody has got a role. You have got a role as a doctor. You have got a role as an administrator. And you must work in synergy. You must work together. So the way they respond to me as a clinical staff, my admin officer will also respond to me as an admin staff. I came here today, I'm the only doctor here. The two people that followed, they are both administrators. And you see, that is what gives you a hedge. Being a clinician and also being an administrator, and makes a lot of difference in the way. So the response is the same. The way an administrator will respond to me is the same way a clinician will respond.
All right, so give us an insight into your journey, your engagement now with non-clinical staff, non-clinical administrators in your leadership role in comparison with that of your clinical staff.
Okay, thank you very much. Well, just like I said, as a chairman medical advisory committee, that's where I started, having to have a relationship between the clinical staff and also administrative staff. In a teaching hospital structure, you have the CMD on top, you have the director of administration on one side, you have chairman medical advisory committee on the other side. Now, the two wings, they are the support that gives direction and support to the CMD. That is the chairman, the CMD, the chief medical director. Now, the administrative hand and the clinical hand, headed by CMAC, they must work in synergy. Now, if you are talking about clinical staff, you talk about all departments in the hospital, ocular surgeries, you talk about surgery, you talk about all that. And then in administrative end, you have areas of central administration. You have the core area of corporate planning and research. You also have area of HR, which is the what we can refer to as establishment. Okay, and at every point in time, the two of them must come together in forming a committee.
Okay. Like
as the chairman of medical, I am the chairman of manpower development and training. The desk officer is a director. Now, the two of us must work together in synergy to ensure you are thinking about somebody who wants to go for training. Oh, do we really need that training now? Is there availability of funds for that training? As a clinician, I will now look at it from the point of saying, yes, as a clinician, yes, we need it. We need an endocrinologist here. Okay, administrator will come from the point of, is there availability of fund? Okay, how many people have gone? How many people do I have on grant? Okay, so by the time they come with that position, as an administrator will come with this position. The two of them will now work together to make a system or formulate a policy to drive a system. So we must work in synergy. And for instance, I mentioned the fact that you can have a structure. The policy statement is being driven by any establishment. Is a collaboration of both clinical and also the administrative services. So you cannot separate the two. The two must work together.
Before we go on, I want to really ask, if being a clinical staff, I mean, being a physician and being an administrator, now the head of, the hospital, there are several requests that will land on your table.
So many.
How does it, being, one of them, not just an administrator that is just, overseeing their affairs, does it, make you more empathetic towards, their plight, towards their needs, as their administrator now, but coming from the part, the angle that you're also one of them?
Yes. There are so many requests that will come, and that is very sacrosanct. And that is why I mentioned the fact that there are two of these areas, the clinical and the administrative end. They play advisory role to the CMD. Now, they must have sieved all those concerns before it gets to me as a CMD. So there is nothing that will make you, because you must be empathetic to their cause. Whether you're a clinical staff, like for instance, let me give you an example of what the XFC did recently. When I came on board, there are some group of people who are a set of administrators for many years, who have not been privileged to have them placed where they're supposed to be. They call it regularization. Somebody that's supposed to collect X amount of money is collect far less than that. And he has been on that position for close to 14 years. When I came over and I look at it, DA, come, let us reason. What happens to these people? Why is it that these people have not been given the privilege? Why is it that they are going to be suffering and delivering the best of service, to humanity? And we look at it. And then we spoke to Mr. Governor. Mr. Governor, in his magnanimity, said, no, if you want these people to work well, why don't you give what they are requesting? As administrator, as a staff, we're able to meet their needs. Ditto with doctors. Doctors will come with their request. Oh, we need a call duty allowance. Oh, we want our call full to be met. Oh, we are doing. Everybody is important. And you must give reference to what they do, so that at every point in time, they will be able to give in their best, whether as an administrator or even as a clinician. So you must not be seen to be partial. You are on top of all. And you must admit the fact that you must give them the best at all times.
All right. So now, Doctor, in your opinion, what unique value do you think a physician, is bringing to the administrative role that a non-clinician, may lack?
There are subtle things that we learn in clinical services. There is what we call empathetic care in service delivery. An administrator may not per se have a feel, a touch of what we see as a clinician. They work behind the scene. But a clinician will see in reality what we are talking about. Let me give an instance. As the CMD of an institution, I am bothered if there is no illumination in a hospital. I am bothered because an administrator may not really understand, this general energy is very important at this point in time. I have to connect this. Oh, I have to sanction the airway. I have to do this. They may not really understand, even though they are working in the hospital environment. For a clinician, will you be beyond that? And I will not be the one to release the fund to buy fuel into generator. We just finished a crisis in the hospital where the IBDEC decided to take off the grid from the hospital because we are owing them some amount of money. They are administrators. They don't understand the implication of what they have done. Because, for instance, taking us away from the grid, it can cost life. So a clinician will look deep to understand the fact that as a clinician, this singular act can cost life. But from the administrative point of view, they are the one to run the game to ensure that the letter is written. Oh, we want to the IBDEC. Oh, we want to get fuel into a generator. Oh, the finance release the fund. As a CMD, as the overall head, you must bring the two together. Those who are there to see, those who will work behind the scene to ensure that that delivery is done per time. And there is no waste of time. And that is where empathy comes in. You must put every patient in your own position. Because I tell people that those who commit criminal abortion, they don't know whether the person that will save this country is the one that they have terminated. A normal person will not think in the same direction I'm thinking. But you must put empathy. Many people have brain death because certain things is not done for them. And unless we now appropriate ourselves to understand that we must put patient in our own condition, to understand that we have to underscore the fact that they are also very critical. So administrator may not think in that direction as such as a clinical person will do.
All right, before we go on a break, how do you handle ethical conflicts between clinical judgment and administrative constraints?
There shouldn't be any conflict of interest.
Okay.
Because the civil service rule has what we call PSR. They call it, that is a public service rule that guides the operation of any establishment. There is operational manual that dictates what everybody is bound to do as an administrator, as a clinical staff. So ethical issues is common to both parties. If you don't put ethics, a clinical person will be held. The same thing with administrative staff. So everybody has got a role. There shouldn't be any conflict of interest.
But what happens in a case where you have a life to save and you're asking this person or his family to, make an installment, make a payment in installments to, and there is none. So what happens? There will be conflicts there.
There is conflict, but you see, that conflict can be managed. Everything has got a solution. Like, for instance, in my hospital, the administrator handles the aspect of, it to move fund. We have to raise some fund, get some fund in preparation for people of that category who cannot afford. Even not only them, we have made a policy that anybody that comes to us within the first 24 hours has to be treated. Because it's only the living that can pay. Anybody that is gone for life. So even when he's dead and they are able to provide 200 million naira, that money does not serve anything. But the policy has been made that you come to hospital the first 24 hours, you have your medical care, you have your medical treatment. So there is nothing that can bring conflict once the policy is established. And that is what we are using to drive the system. Having a policy statement, everybody key into it. Because if, for instance, you as a clinician, you say, okay, we have to go to theater now. Somebody is not doing what. There is a rule. There is a punishment. You can't just violate or decide to say, okay, because it's very well, you just sanction the person. There is a rule. There is a process. Even before you sanction anybody, you must firstly set up a committee. A panel will be set up, headed by a non-biased person, both in clinical and also must be representative in the admin. They will sit down together, come out clearly with where are the gray areas. There is also a disciplinary committee that will also sit based on the panel discussion before it comes to the management. And on PSR, it's very clear, if you have not done this, this is the punishment you deserve. Okay, as an administrator, this is the punishment you deserve, even as a clinical staff. So there will be conflict of interest. Everybody must be seen. I tell people that if you find ourselves outside the country, people key into whatever they do. It's only in Nigeria that people play games with people's life, and it's not helping our system. If you find yourself, you are working for 12 hours, you must not be seen to blink your eyes. You must not be seen to be sleeping. You must be seen to do that work that you are being paid for. And you get to your place of work 8:01. You're supposed to get to your office at 8. You get to your office at 8:01. You can be sanctioned and locked out. You can't get into that system again because there's a system in place. There is a policy in place. And what drives that driven by policy is to get that better for it.
All right, just in simple answer now. This policy that you spoke of, the first 24-hour treatment, is it a general medical rule or it's just particular to the hospital?
It's particular to my hospital.
Okay.
Because when I see the way people, many people, they are involved in accidents, they don't have money, you'll be looking at them shouting. But the policy is, we have got a park for them. We started that when I was a CMAC with the former CMD. You get to accident and emergency, you are there, you are treated the first 24 hours. And after 24 hours, you are made to go and make your payment. Even all those things you have used is a revolving park. You must pay back.
All right, dear viewer, we'll be taking a quick break now. When we get back, we continue from here with Dr. Afolabi. Stay with us.
Illegal bushmeat is not cool, but it's on sale in our cities, risking extinction and our health. And many of our iconic wild animals are threatened. So please be cool and say no to illegal bushmeat. And let's make Nigeria better for wildlife and safer for us all. Keep them wild, keep us safe.
Our comedy is winning fans globally, but we are losing our wildlife to illegal bushmeat, and this is not funny at all. If we continue this way, we will risk losing all our animals and leaving nothing behind for the generations to come. Tell your family and friends not to buy or sell illegal bushmeat, because protecting nature protects us all.
So from bedside to boardroom, managing, balancing medicine, and management right here on Spring Clinic, Western Spring Television. I've been speaking with the CMD of UNIOSUN Teaching Hospital right here this moment, Dr. Babatunde Afolabi, who has been talking to us about several, things relating to administration and, being a clinical staff. All right, so doctor, let's continue, on what we've been speaking about. So what are the core missions and visions of a teaching hospital using?
Well, teaching hospital is mainly meant for clinical services.
Using UNIOSUN as
it's meant for clinical services, for training, and for research.
Okay.
We breed medical students, we treat medical students, paramedicals in a teaching hospital to become a full-fledged doctor, full-fledged nurses in different special areas. That's what teaching hospital is about. It's the tertiary care. We have primary, we have secondary, and we have the tertiary care as services in a teaching hospital. And as a teaching hospital, the way and manner is structured to train. Is structured that what cannot be handled at the primary care level, that cannot be managed at the secondary care level, is being managed at the tertiary care level. So, and that is what makes a difference, between primary, secondary, and tertiary care. But the core area of interest is in the area of 1, clinical services, 2, in the area of training. That's why we come about training of doctors, training of nurses, training of radiographers, training of laboratory technicians, training of all those things. And then thirdly, in terms of research, the jaw-breaking researches takes place in a teaching hospital.
All right, so it's not the hospital of first care. Like some of us who just get sick will go to the teaching hospital.
It can so happen because like there are primary care physicians also in teaching hospital, but they will not be the one to oversee all cases. They make referrals. There's what we call vertical and horizontal referrals. Like a primary care physician sees a patient, diversify those patients. Oh, this one is a surgical case. This one is an ocular case. He make a two-way referral straight to an ophthalmologist who sees the patient. And the ophthalmologist cannot handle, this patient is diabetic. Oh, why not send to an endocrinologist? So, and that is why teaching hospital model is even the best of care. You treat primary, you treat as secondary care, also you treat as tertiary care.
So, what are the benefits of visiting a teaching hospital for diagnosis and, treatment?
It makes treatment more holistic.
Okay.
Because it is not one-man show. It has to do with bringing in, different specialists, and different other fields coming together to manage a particular case. Let's give an instance. A patient come involved in a road traffic accident, has a fracture of the leg and is diabetic, is hypertensive, and then you discover he also has glaucoma. Okay, this can only be managed in a teaching hospital effectively because it's a teamwork. It's the work of a general surgeon, orthopedic surgeons will come. Apart from that, endocrinologists will come. Eye specialists and ophthalmologists will come. And all these people will come together to manage a single entity. So, and that makes it a teamwork, make it more robust. And it's not a one-man show. And it's cheaper, relatively. Because if you go to a private hospital and then you want to see different specialists like that, you pay more. So, but people don't understand the concept of a teaching hospital. People only feel that if I come to a teaching hospital, I can buy time. Within 1 minute, I see doctor, I go away. No, it's not so. Because it will see you, for instance, a medical officer will see you, a registrar will see you, a senior registrar will see you, a consultant will see you at that care. A consultant will see and want to invite another consultant. That's what makes the teaching hospital. So in that process, you are seeing many, many, many doctors. In one visit, you can see 4 doctors. In one visit, you can see 5 doctors. In different special areas. What this one cannot pick, the other one will pick it. And that's the beauty of a teaching hospital.
All right, so let me pick that word. So what's the beauty of, training and retraining the medical staff in a teaching hospital?
Oh, fantastic. It's one of our core values. In fact, the structure or policy in place is you have to give 5% of your total income on training. Because it is in training you can add value to the system. Well, let me give you an instance. A general surgeon can be a general surgeon who will now specialize in laparoscopic procedures. Gone are the days people will open people from up down and open the entire stomach to do a particular procedure. But we are so advanced now through a pinhole procedure. And if it has not gone for training, there is no way we would have been able to do that. The other thing is that there is what we call retina. There is this something retina in the eye. In those old days, we cannot take care of retina detachment. But nowadays, we have people who are specialized to take care of that. So you find them also in a teaching hospital. If you are an endocrinologist, you can specialize. I will only see diabetic patients. I will only see, thyroid cases is what I will be managing. And that is why teaching hospital is quite different. And it is better for people to visit so that you can get the best of care at all times.
All right. So far, would you say that UNIOSUN as a teaching hospital can successfully compete with other teaching hospitals, at least right here in Nigeria?
Yes, I tell you sincerely, and we are so blessed to have resource persons in the teaching hospital. We have trained hands, like I train in the UNIOSUN teaching hospital. Even becoming the CMD of that teaching hospital, competing with others. So the teaching hospital can compete with both the local, the international teaching hospital. So many grants and studies are taking place here. So, and people don't value what they have. That's what I've seen. People don't value what they have. As a teaching hospital where people are getting trained, very soon we're going to graduate the first set of doctors in the teaching hospital here. And government is doing a lot. Our government, they have really invested in this hospital in terms of, structures, infrastructure. Once a time, this hospital was the best private-owned state teaching hospital in Nigeria when it was lauded. And as we are advancing over time, because of this variance and separation, a lot of things happened. We are getting settled. And with the input of the government assisting us with getting equipment into the hospital, assisting us in clearing some debts that we have owed over the time in terms of all this electricity and all this, they have really been of assistance. So we sincerely appreciate His Excellency, the Governor of the state, Senator Nuruddin Jackson Adeleke, for the giant strike. Recently, I just mentioned that the electricity bill, the government has paid to this teaching hospital 140 million that has been given for us to restore back to the grid of NEPA, because it's not sustainable using a diesel. We were running on diesel for that 6 weeks. We were paying almost 1 million naira to buy diesel every day, every blessed day. And the government looked at that, well, we have to come to the rescue of these people. And they came and they supported us. They have given us the leverage of having a PPP arrangement in so many areas. Like in renal dialysis, we can have people coming, and then we have already finished having a kind of a synergy, a kind of relationship of establishing a PPP relationship for renal transplant, for renal dialysis patients, for so many other departments like radiology, having things in place. These are things that we want to appreciate His Excellency for. We are still thinking to have many other equipment. We don't have an MRI. We don't have a CT scan. If somebody is sick now, you have to take that patient to Abuad. You do a common, you are from Ekiti. Abuad, you have to go and do an MRI in that place. Or you go to Bomashaw. Government is looking in that direction of getting us an MRI or giving us a CT scan. You see, we just had a meeting of during MTSS, and I was telling them that, a teaching hospital must stand to be a teaching hospital. A teaching hospital where CT or MRI is not available is not yet there. And the government said, yes, because you have not been providing for it in the budget. He said, put it in the budget. So we have a listening governor who is willing and is ready to make a system better for us. In UNIOSUN Teaching Hospital, we have 3 gastroenterologists. They are not very easy to find. In UNIOSUN, we have 5 radiologists. So if you have an MRI, we have a CT scan, we have people who work on it. They are being underutilized. And government is paying. As I when do they pay salary? So why can't we get those equipment for them to be more useful for the people of the state? If you want to go to Ekiti now, you get some money on transport, you risk your life, you do all those things there. Sometimes you get as you can't do it today because there are too many people. Wait till the next day. You can imagine that pressure. But if you have it here, you go in, you come out. And that is what government is working on. And I pray very soon it will materialize. All
right, as we begin to custom, let's talk about the medical breakthroughs that you've recorded so far here at UNIOSUN Teaching Hospital.
Yes, thank you very much. So far, so good. Just like I said, we have different specialists. We have some arthroscopic surgeons who are now available with us. I was just doing a sort of analysis, and I discovered that we have done well over 100 different hip replacement, knee replacement procedures in UNIOSUN Teaching Hospital here. Things that people will go to Lagos and they will spend millions of naira. We have done it, and we have good success rate. We have good, very excellent success rate. And I was talking with the surgeon some time ago. I said, this is a hip replacement. I saw it then. It was when I traveled. I saw that people can replace their knee like you are changing ball and socket joint of a car. And that's what we have been able to achieve here. And not only that, there are some special, we now have a visiting cardiothoracic procedure. There was a time they saw something in the heart when they did the procedure for that a child, and they sent the picture to me. I said, wow, this is really, really wonderful. You know, we have got a number of cases being managed. There was a time somebody with pulmonary embolism came into the hospital. It was a very important personality in the state, with the complement of interventional cardiologists, with the intervention of our radiologists, everybody coming on ground. That guy came back to life. In fact, the day I was going for one procedure in Lagos, I said, wow, this is possible in a teaching hospital. I was overjoyed. I was so happy. Now come to think of having all this equipment, you can imagine where we would have been. So we are really doing so well.
All right, Doctor, let's talk about you now for a change. On a lighter note, how do you juggle these responsibilities? I mean, the burnout from being a physician, an administrator, with all other, family is also there, and then in light of that, what advice would you also give, other physicians, who are aspiring, to take up leadership roles?
Thank you very much. It's multitasking, and to be in this kind of office, you must also be prepared. Preparation is the first thing, and God on your side is the primary. Because it's only when you have God on your side that all this multitasking role you can successfully deliver. And as a father in the house, your children, your wife must understand the role that you have taken. You are in it together. Okay. And in the office, you can't do it alone. You must have people that you trust that can work together with you. In the sense that you can have different committees. I run a committee system. Like, for instance, there are people who are for price intelligence. They come back, they give me a report. I must sit at the level of reporting. I cannot be everywhere at the same time. Okay? Assess management, that they are working, they come out with their reports. And the other time, I just look at, I said, oh, we must have service delivery committee. There is a committee that looks into how services are being delivered. Security committee. All these committees will come with their reports, and you are not there alone. Like, I have 10 management staff. I told them one time, I said, you are the soldiers upon which I lean. Okay? And it's only a team that wins a race. An individual plays the game. Now, if a team comes together, they can overcome. It's just like Yoruba, we say that you want to fight against a snake, you first of all see cobra coming. The next thing you see python following. The next time you see viper. All of them are coming together. There is no one that will stay. And that is why teamwork is very germane in the teaching hospital. You can't do it alone. You can only try your best with God on your side. You must also listen to people. You must not be judgmental. You must not assume the position of an autocratic leader. It must be democratic. Okay? No matter how best you are, you remember you borrow from the knowledge of others so that you can drive a system. So God has been of great help to me in terms of the people I work together with, in terms of the government of the day, because if you don't have the support of the government, you cannot even achieve anything. The government is there. The vehicle I brought here is given to me by His Excellency. He has made it work. So I was in Lagos yesterday. I drove, very, very smoothly to deliver the state mandate. If the government has not done all sorts of things, there is no way I would have been able to achieve some of those things. They make life easy for us. So, and again, you leverage on other people's ideas. I've had a management meeting today. I just finished at 2:00. What's your view about this? What do you think we should do about this? And everybody brings their knowledge together, and then we'll be able to drive. So, and to advise my colleagues, it's doable. It is quite not impossible. If I can do it, you can do better. So I want to believe that preparation starts immediately. And you must be focused, realizing that it can only be possible when you have a willful nature and you are not judgmental. You are not partisan. You are not thinking that, hey, I'm better than this, or this one is better than this. You leverage on everybody's intelligence to drive at what you want. It's quite doable. Thank you very much.
Thank you very much, sir, for joining us today and for, shedding more light on, juggling, administration and, being a physician together. Dear viewer, today on Spring Clinic, we have the privilege of having the CMD of UNIOSUN Teaching Hospital right here with us in the studios, who has talked about his role as an administrator and as a physician right there. Thank you so much for taking time out to be here on the show. We also appreciate your people, your team, for releasing you to us. All right, everyone, if you have missed, following us live, you can also watch us on YouTube, on all other social media pages, on our social media pages. You can catch up at Spring Clinic today. All right, thank you for joining us. One take home that you can take home from this particular episode is that the doctor said that an individual plays the game and a team wins the race. Now, which will you choose? Take it from someone who has worn many hats in administration and who's a physician. Take that home. My name is Boardroom Adeola Afolabi. Thank you for joining us today. We hope to see you again next week. Bye-bye.